When is the appropriate time to start thinking about spinal surgery? Hi, I'm Dr. Jonathan Chung, and I'm an upper cervical chiropractor and functional neurologist. When it comes to surgery, really, no one really wants to have surgery done to them, but this is particularly true for things like back surgery, because decades ago, back surgeries are really highly overprescribed and the outcomes weren't so great in terms of just long-term pain prognosis. But there are really important times where surgery needs to be on the table during your discussions with a provider. I recently had a consultation with a patient who had neck pain and arm pain, and they were hoping that I would be able to help them out with their neck pain and arm pain. And during the consultation, I noticed a couple things. I noticed that his arm had actually had decreased muscle tone on the side that the pain was occurring, and I also noticed that his hand also started to show some weakness inside of that same side. Now, whenever we see weakness, that's an indicator that there's motor loss that is going into that hand, and the problem is motor loss can be permanent if it's not treated appropriately. Most people think that they need surgery if they have severe enough back or neck pain, if they have bad herniated discs on their MRI, or if they have really bad disc degeneration on an X-ray. The truth is, even the most severe cases of back and neck pain can slowly improve with conservative care over time, and those are places where you really should give conservative care the first shot at things. When people actually need surgeries, if there's clear signs of motor loss. So if you have the classic sign of drop foot, where your foot is starting to drag behind you while you're walking, that's a red flag. If you're having atrophy in your arms or legs, if you notice that the muscle tone between your hands is significantly different, if you notice that in your feet or your legs, that's another red flag. Or if you have spinal cord signs or signs of spinal myelopathy, that's another key sign that we look for when we're assessing a patient. So if you're showing signs of motor loss, then there's a threat that you might not be able to get that motor tone back if you don't act on that appropriately. The hardest calls are in the gray area. So this is when you have intolerable persistent pain that's been unresponsive to conservative care. If you have weakness or numbness on an imaging and electrodiagnostic test show there's a correlation, or if you just have complete loss of function despite doing a lot of conservative treatments, then that's a conversation that you need to have with you and your doctor to try to make sure what the best route is for you from an individual standpoint. Ultimately, as a chiropractor, I spend most of my time helping people to try to avoid surgery, but there are cases where we just have to make the decision for the patient and say, hey, this issue is a real concern and you might have permanent loss or permanent injury because of this, so you need to consider a surgical approach. And this is one of those situations where I had to make that call for a patient despite their best intentions to avoid surgery no matter what the cost.